You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implant dentistry. With us, we have a dentist that has focused his practice on dental implants and cosmetic dentistry. If you're considering dental implants, my advice, stick around for the latest edition of the Wellness Hour.
You've seen it on TV. You're probably watching it right now. The Wellness Hour, the leader in medical news and information, has been on your television over the last 5 years, is now on the web. Log on to wellnesshour.com, where you'll see some of the most intriguing interviews of today's top physicians. Wellnesshour.com provides links to all your favorite doctors seen on the show, links to email host Randy Alvarez, and more. Don't wait another minute. Log on to wellnesshour.com and start feeling better today. Wellnesshour.com. Log on now.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. With us, we have a dentist that focuses his practice on dental implants and cosmetic dentistry. His name is Dr. Al Davenport. Dr. Davenport is the founder of Davenport Dentistry. Dr. Davenport, welcome to the show.
Thanks for having me, Randy.
Let's start with what's changed in the world of dental implants in the past, say, 15 years.
Well, there's been many things that have changed, wonderful things that have changed in the implant dentistry over the last 15 years. But what excites me is the fact that we can take patients that have broken down teeth, old partial dentures, dentures that don't work, teeth that don't really look very good, don't function very well. And with dental implants, it's like we can drastically bring them back to optimal dental health.
Now, dental implants, anticipating this interview, spoke to some people. They weren't dentists, but they said the problem with dental implants, and these were doctors, they fall out. Is that the case? Not the case?
That's not true, Randy. I said, you know, in my practice, I work as a team. I work with a team with an oral surgeon. And when we place our dental implants, we expect them to last a lifetime. That's really our expectations. The national average for implants is probably around 98% success rate.
Success rate meaning it stays in?
Correct, correct. That's the highest success rate of any orthopedic device, you know, being used in medicine. Now, in our team, we're actually experiencing a success rate of 99.6%, and we've tracked that.
For those who don't know you, tell us about your practice.
Well, Randy, I have a general practice. I see many families. I do pretty much everything that a general dentist does. I have a great staff. I like to think that I'm a very good communicator. I listen to what my patients want. I give them their options. And one of the things that I really enjoy is cosmetics. We like to do a lot of cosmetic when patients...
Like veneers, things like that?
Veneers. And one of the other things that we provide are dental implants.
With dental implants, who is an ideal candidate, or what are the different categories of people that would benefit, I guess, from dental implants?
Well, pretty much anybody who's missing one tooth, multiple teeth, or no teeth are great candidates for dental implants. I mean, in my practice alone, I mean, I've done an implant on an 18-year-old boy who, for instance, was playing softball. He was playing catcher, and the guy fouled the ball off. It hit him right in the teeth, and he lost one of his front teeth. And in a case like that, we were able to do a dental implant, restore that tooth, and he really should have that tooth for the rest of his life.
Now, for a single tooth, why a dental implant over, I guess, an appliance, bridge or partial?
Okay, well, implants are much more conservative. I mean, we lose a tooth, we replace a tooth. It's simple as that. You know, traditional dentistry in the past, we try to replace a tooth, we affect other teeth in the area.
How so? How so?
Well, if you wanted something that was going to stay in and not come in and out, you would do a bridge. But when you're doing a bridge, you're shaving down the teeth on either side of the tooth that's missing to make crowns on those so we can make a bridge that can be cemented on. So now we're affecting two other teeth when we've only lost one tooth. The other thing is, with implants is more of a lifetime type thing. So you do a bridge.
What do you mean more of a lifetime? I mean, they last forever? This person that lost one tooth.
Our expectations is with our team is we replace an implant, we expect it to last a lifetime.
Okay.
If I place a bridge, I don't expect that to last a lifetime. So now we've affected two other teeth, and we're going to have to redo it.
Now we've talked quite a bit off camera, and dentistry we've talked is maybe set up oftentimes, not all the time, as patchwork. What do you mean?
Well, I think in dentistry a lot of times, especially when you're missing a tooth, for instance, that 18-year-old boy who lost his front tooth, yeah, we can patch that in. We can do the bridge. We can do the partial. But that stuff is not going to last. We're going to have to do that over again. We may do it over again when he's 30 years old. To me, I think that's more of a patchwork job than doing the implant and just getting it all over with, and he's got something that can last his lifetime.
Now, if somebody watching this and saying, well, Dr. Davenport is just pushing dental implants. I mean, you give all their options?
No, everyone gets their options. I mean, one thing you need to know is I do everything in my office. I do root canals, I do crowns, you know, I do the whole gamut, all right? But people deserve to have options. And implants, in some situations, are the best options. In the case of the 18-year-old boy, personally, I think that's the only option. I would never do a bridge or a partial on my own son if he lost that tooth.
Interesting. Okay. Now, in the front area, the aesthetic zone, I guess is dentists call them, dental implant looks natural?
Absolutely.
You can match it to the other teeth?
Yes, we can now. I mean, that's one of the things that have come out with technology in the last 15 years. Originally, when implants were started, it was a function thing. We wanted to replace teeth that were missing, but basically we're getting in there so they can chew with it. Well, that's all good, but as time caught up, we want to do more than just do function. I mean, I have a passion for cosmetic dentistry, and I do a lot of cosmetic dentistry on patients, and I feel that you can do the same thing with implant patients. And some of the technology from the cosmetic field is now coming over to the implant field, and we're able to simulate teeth, make them look lifelike, like they're natural teeth.
Who else benefits, then, from dental implants? Okay, so the single tooth.
Correct.
What else?
Well, there's people who have multiple teeth missing. Maybe they have teeth missing, they've worn partials, or maybe they just lost back teeth. And in those situations, their only thing that they could have done is a partial denture that comes in and out, or they could have implants put in. There's people that have no teeth at all. And having no teeth at all, they're wearing dentures. And a lot of times those people, it's been a long period of time, they've lost bone. And there's really not that much to put a denture on. And that's where dental implants kind of come to the rescue with those patients.
How so? How so, by the way?
Well, especially lower dentures. Lower dentures, I don't know if you know this, Randy, but 2 out of every 3 people who get a lower denture, that denture ends up in a drawer. They don't even wear it.
Okay.
Okay? Lower denture is the hardest thing. I mean, if at all costs, we don't want to make a lower denture as dentists. We just don't want to do it. But now, it's fantastic. Now that we have dental implants, we have something to help that patient out. For instance, I have a couple models here on a lower denture case.
Let's take a look.
You know, I mean, this model right here, it talks about a patient, has a patient where we put 2 implants. Okay, only 2 implants, all right? And what we did is we made attachments then that would go over these implants and help hold this denture in place.
So a snap-in denture. So the denture wearer, so I get this straight.
Correct.
Somebody wearing dentures now.
Correct.
They could have 2 implants.
Correct.
Get a snap-in denture.
That is correct.
Okay.
And many times, this is good enough for some patients, right? If they have enough bone, a couple of implants makes a big difference.
So they just snap in, snap out with your hand.
Right.
Okay.
It just snaps in and snaps out. Now, there are some patients who have absolutely no bone on the bottom. Okay. Now, 2 implants might help a little, might not help that much. And there's other people who they want to have the strongest fit they can. They want something that's in there even stronger. Okay. They want to feel like they don't even have dentures. All right. For those people, we can put more implants in. Like, for instance, this patient here, or this model here, we can put 4 implants in. Okay, now we got 4, not 2. And then we have this stabilizing bar. We have a bar that connects them all together. That bar even makes the implants stronger than they were before.
Okay.
Now, with this, with different variations of retention and stuff, we can have something that we can snap in place that's even stronger than the other 2. I mean, it is hard to take this thing out.
Let's see this. Okay. But the patient can take it out of their mouth.
Absolutely. We
So
teach
this is
the
like
patient
having their own teeth back.
Exactly.
4 implants.
4 implants.
Now, going into this interview, I'm thinking for the dental, you know, that you add up your teeth. How many teeth do you have on the bottom, by the way?
Well, normally you have 32 teeth, so you have 16 teeth on the bottom. Most people don't have wisdom teeth, so let's say 14 teeth.
Okay, so you don't have to have all 14 to get to the denture wearer. You don't need 14 implants.
Well,
2
absolutely not.
or
absolutely
4.
Not. Absolutely
You think
not.
that's a common misconception about dental implants, that it's all or nothing?
I think so. I think so. I don't think people understand the options they have with dental implants, especially replacing all their teeth.
Now, what about the denture wearer that's been wearing dentures for 20, 30 years? And they say, I'm 60, I may have diabetes. Are they still candidates, or it's too late for dental implants?
No, it's not too late for dental implants. A a lot of patients, what happens, people don't realize that when they lose a tooth and they lose a root in the bone, that bone is going to disappear now. That bone stays around because that root is stimulating it. And that's one advantage of getting implants in as soon as possible. You get implants in, and what that does, it maintains that bone.
How? I mean, how does a dental implant keep your bone?
Well,
are we talking about the bone underneath the teeth, the jawline, things like that?
We're talking about the bone that the teeth used to be in.
Okay.
I mean, that's what the denture is going to fit on top of. But what happens is, a lot of times people go by and they won't replace teeth, and over the years, and then by the time they do go to replace teeth, there's not that much bone left. And the reason that is the bone comes and goes every day. Your bone is coming and going every day of your life, Randy, but people don't realize that. But once they have no stimulation, and a partial in a denture does not give stimulation to the bone, only roots do, that bone starts to disappear. So by putting dental implants in early, you're maintaining bone. And now, I'm sure you've seen patients who their face unfortunately have kind of sunken in. They look older.
That old look, right?
That old
look
look,
sink in.
You know, that old look, and that's because they don't have teeth, and their bone has just basically disappeared. So now their facial contours change.
So back to the original question: somebody wearing dentures for 15, 20 years.
We can bring those patients back if we do implants and construct the dentures to also simulate their regular bone that used to be there. I mean, we can make them look like they were 20 years ago, 30 years ago.
So 2 or 4 implants on the bottom, they could chew again.
Absolutely.
Now, you said a bold statement to me on the phone. You said I could change their lives with dental implants.
Yeah, you
Is that an overstatement?
No, you know what? That's not an overstatement. I mean, there are people who
Be specific then. How so? How do you change their lives?
Well, there's a lot of people out there that go around and they just accept their dental condition. Over the long time, they just haven't had good luck with their teeth. And over the years, they've always didn't want to smile. They couldn't chew that good. Their speech wasn't that good. And they really just didn't have confidence. I mean, the confidence of their teeth moving around on them. Dental implants gives us a way to bring them back and feel like a person that has all their natural teeth. I don't think people realize, people that wear dentures, what happens is they have to accommodate to them. They kind of get used to them. You know what? They lose a lot. They don't remember.
They get used to their dentures.
They get used to their dentures. I mean, studies have shown that someone, even if you have the excellent fitting dentures, I mean, your chewing efficiency with dentures is 15 to 20% of someone who has all their teeth.
Really?
Right? So you're losing
80% less.
85%, you've lost your chewing ability. Right? And these people kind of get used to it. They try to accommodate, but you know what? It's not the same. You give them dental implants, all of a sudden they're back.
What do they say to you, by the way? They should have done it earlier?
Well, I tell you what, the patients who do it, I've never had someone say, oh gosh, I wish I'd never done this. They never say that. They always say, why didn't I do it earlier? Why didn't I do it earlier? They lived all those years, compromised. When I say compromised, I mean they just couldn't chew as good. They were self-conscious about their smile. They just really didn't have a good self-esteem about their teeth or their smile. And dental implants can bring that back.
I knew I was going to interview you. Talked to my mother, 72 years old. She's wearing upper and lower dentures. After our conversation, I said, Mom, you need to get dental implants maybe. And she says, I'm too old, 72 years old. She says, I have a little bit of osteoporosis. What do you say to those people? Candidates, not candidates?
They're still candidates for implants. I mean, you can have patients up into their 90s that can have dental implants.
90 years old getting dental implants.
Yeah, there have been patients in their 90s getting dental implants. It's a question of quality of life, too. If you have someone who, like your mother, I don't know how she is with her dentures, if she chews very well. My guess is probably not. But if she had implants, and you brought up osteoporosis, osteoporosis is not a contraindication for dental implants. We can do dental implants on those patients. I mean, some patients, yes, we have to do a little bit more so they can have dental implants, but that's why I work with a great team. I work with a great oral maxillofacial surgeon who really is just like a pioneer in implants. I would not send anybody else to another person other than him to do the implants. Now he can do.
Now he places the implants.
He places the implants. All right. We work as a team. I see the patient. We decide on it. We decide a treatment plan together, and then from there he places the implants, and they come back to me, and I restore them and do whatever we need to do to bring them back to optimal health. But there's always a lot of things that you can do to get implants to work. That's why I always work with someone like that.
What about those critics? And I guess the post that the tooth sits on is metal. What about those people that say it's not safe to put metal in the mouth?
Actually, the metal that is used in dental implants is titanium, and titanium is one of the most safe things to put, and it really binds to bone. I mean, actually, titanium was found, it was an accident. We found that titanium, even that bone would bind to it years ago in the 50s. But titanium is something that, they use in all kinds of prosthetics. They use it, in your hips. They use it, in knees. They use it all over the place. And titanium there's no contraindication using titanium. I mean, it's very safe. I mean, it's like part of your body once you put it in.
Okay, we're going to take a quick break. We come back, more about who's a candidate for dental implants. And also, I want you to take me through the process. What happens on day 1, day 2, the downtime, those things. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants with Dr. Davenport. We'll be right back.
It is now clear that not only are nutritional supplements vitally important to maintaining good health, but studies show that they can help reduce the risk of and successfully manage many diseases. I've done my homework, and the nutritional supplements I take, give to my family, and recommend to my patients are from Designs for Health.
Designs for Health, the leader in professional brand nutritional supplements. You've seen it on TV. You're probably watching it right now. The Wellness Hour, the leader in medical news and information, has been on your television over the last 5 years, is now on the web. Log on to wellnesshour.com, where you'll see some of the most intriguing interviews of today's top physicians. Wellnesshour.com provides links to all your favorite doctors seen on the show, links to email host Randy Alvarez, and more. Don't wait another minute. Log on to wellnesshour.com and start feeling better today. Wellnesshour.com. Log on now.
You're watching the latest edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants with Dr. Davenport. Before we get into the process, I want you to take me through the process of the implant process. Let's go over the different categories of patients and who would benefit from dental implants.
Well, basically, the categories of patients are missing just one tooth. They need that one tooth replaced. There could be people missing multiple teeth. We're doing multiple implants. Or there could be patients that don't have any teeth at all. And we're doing implants to help support their denture.
For the denture wear, again, their options.
Yeah. Well, with the denture wear, we're able to give them, even like on the lower, we can give them 2 implants. It gives them something to help snap that denture into place. I mean, we get them out of using the different adhesives and stuff that are out there on the market. Basically, as we said before, 2 out of 3 of the lower denture wearers aren't even wearing their denture anyway. It's in their drawer. So this is a way for patients to go get that denture out of their drawer and put it back in their mouth.
Snap in, snap out.
in.
What about a fixed, permanent?
You can do fixed too. We can actually do implant dentistry, even if you don't have any teeth. We can do implant dentistry in which, we can actually put that down in your mouth and it cannot be removed except by the dentist.
Now you mentioned that 4 implants, 6 implants. What about all the teeth having implants? Does that happen? Is that ideal?
That's possible. Sometimes we can do, there's a couple different categories of that. We have cases where we can do implants and we can have something made that's it's like a denture, but it actually is fixed in the mouth and the patient can't remove it, like I showed you on these models before. Right, now that's for the patient who has lost their teeth over time and they've lost a lot of bone, right? So if we were just to put only the implants in and put crowns on those implants,
like a couple of, okay,
yeah, it just would look bad. It would look bad because there's no gum structure there anymore. Everything's shrunken down, right? So in that case, we still need the denture, although we can still put something in that doesn't come out. Now, if a patient is young enough and they lose their teeth early and the gums, the bone is still there, well then, yes, we can do regular implants and do crowns, bridges, and we can fix that down and look just like natural teeth.
So where does somebody start? Somebody thinking, okay, I'm considering dental implants.
Well, I think day one, they just need to come into the office and be evaluated. So we can look at them and we can give them their options, as far as what implants can do for them. So I would strongly encourage people out there who do have missing teeth, have broken down partials, have dentures, get to a dentist who does implants and see what he can say, what he can do for you.
Okay, on day one, take me through that process. Somebody comes to you and they say, okay, doctor, I got a full denture, I'm missing a few teeth. What do you do?
Well, the first thing I do is we do an oral evaluation. So we'll look and see, well, what do they have right now? What is the condition that the teeth that they have right now, if they do have teeth, and see what are good, what's bad, what are we going to keep, and what do we need to replace? And that determines basically what our treatment plan is going to be as far as helping those people out with treatment with dental implants.
Do you meet with these people one-on-one, or is it somebody else?
Oh, no, I meet with them one-on-one. Oh, absolutely, I meet with them one-on-one. I mean, it's, I get to know all my patients. We actually take digital photographs and everything to help study and go over those with the patient in our office. Now, it doesn't stop there, though. I mean, I can't, even though they've come to me to have dental implants done, I have to work as a team. I work with a team with an excellent oral surgeon. His name is Dr. Karopoulos, and he's a pioneer in the field. He's put in more than 5,000 implants in his career, and it's very important that you have a good surgeon.
I've been told any general dentist can put implants in, and you think that that's a mistake, possibly.
Well, I'm not going to say on the program that general dentists cannot put implants in, but they can put in the routine implants. But what happens if something's unusual or something goes wrong? I want a surgeon. A surgeon can allow me to put implants in some patients that I wouldn't be able to do by myself, or even if I had training and just putting in regular dental implants, I would have patients that wouldn't get the benefit because I'm not that good of a surgeon.
Okay.
Right?
So
a surgeon opens up a whole new area, and the guy that I use is unbelievable. I mean, he teaches oral surgeons himself. He's a national lecturer, international lecturer, and he's a great mentor too.
Do you think it's fair to say that there are people out there, people watching this, they're wearing dentures, or maybe because they have bad gums or something like that, but they say, I'm just not a good candidate. There are people that are self-diagnosing themselves. There are people that could benefit, I should say, from dental implants that aren't doing it.
I think
and if so, what do you say to them?
I say you need to come in and get evaluated. I mean, most everybody can have dental implants. It's not a question of, am I a good candidate for dental implants? It's a question of, how many dental implants do I really need?
Okay. What about people that say this? Dental implants cost too much. What do you say to them?
You know what? That's a very good question, and that's something that comes up routinely. I think people need to come in and see how affordable dental implants can be. I mean, dental implants, you got to understand, we talked about patchwork dentistry in the past, earlier on the show, and really what happens is dental implants, we do that, and myself, my team, my oral surgeon, we expect that to last the rest of your life. We cannot do that with any of the other traditional dentistry out there. The bridges,
so in the long run, you think it might be less?
Well, economically, it's more economical to do dental implants. And it's more economical to do it sooner before you keep losing more and more teeth, because it's a domino effect. You lose one tooth, all right? So now we do a bridge. Now we affect two teeth on either side. Now 15 years from now something's wrong with the bridge. Now you may be losing one of those teeth, or maybe both of those. Now you're missing 3 teeth, all right? You're better off just replacing that one tooth with an implant to begin with. Don't affect the rest of the teeth. Just replace the teeth that are missing, and you're saving yourself in the long run.
You think it's the future of dentistry?
Yes, I think it is the future.
Like dental implants will become the gold standard instead of the bridges and the partials and things like that?
I think dental implants should be the gold standard right now. We just have to get the word out there so people understand how much implants can impact their life.
Okay, if it is good, if they are good, and as good as you say.
Sure.
Why aren't all dentists saying, hey, maybe you need to get implants? Tell me that.
Well, that's a touchy subject. I mean, most dentists, we should all be telling people about implants. Right, but there's a lot of, I was shocked. I was surprised. I belong to an implant study club.
You're an implant club.
We're in an implant study club. This club I'm in, it was started by Dr. Karopoulos. It started in 1996. It was actually the first pure practical or implant study club in the nation. And that's been meeting on and on since 1996. And we were in a meeting 2 weeks ago, and one of the dentists brought up that was in the club that he had recently gone to some continuing seminar. There were 300 dentists, and these are all dentists from my area. 300 dentists in the audience, and they asked them, they said, how many out here are doing dental implants? And it was shocking, like 40% of the people were doing it. 60% of the dentists out there weren't doing it. And I think that's a perception problem out there.
So if they don't do it, they don't offer it, possibly, in some cases.
I think that's true. I think that's true. I mean, they're comfortable. You know, we're all taught. I mean, I graduated from dental school in 1983. Okay. I mean, I knew really nothing about implants. I knew nothing about veneers. I knew nothing about a lot of stuff that's advanced since then. And I think dentists, you get in your comfort zone. You're comfortable doing the bridge. You're comfortable doing the partial. You're not really sure about doing, say, an implant overdenture because you haven't done one before. So you tend to not even suggest that to the patient.
So find a dentist that does implants.
Find a dentist who believes in implants and restores implants.
They're safe.
Absolutely.
And they work.
Absolutely they work.
Okay. About the process. Okay.
Sure.
So somebody goes in, you've decided I'm going to get dental implants.
Right. Okay.
What happens next?
We've done our initial evaluation. The next thing I would do is I send them over to the surgeon.
Okay.
Now I send them over to the surgeon, and we've already talked about what our plans are. What are we trying to accomplish here? I send them to the surgeon. Once they make the appointment with the surgeon, I'm talking on the phone with the surgeon before they even get there.
Okay.
So the surgeon already knows what's going on before that person shows up. Now he's going to go over there and he's going to take a special X-ray to see their jaws, and then he's going to sit down and he's going to talk to them about their options with dental implants and what we can do. And then between the two of us, we formulate a plan to restore them to optimal health.
Okay. Now, they're in. You put the teeth on. Yeah. How soon can they eat and chew and that kind of thing after that? After placing the tooth on the implant.
Okay, there's been that's one of the advances that's happening in dentistry today in implants is, I mean, in 1965 the first dental implant was put in. At that time they thought that you take a tooth out, you wait a whole year. After a whole year, now you put an implant in it, now you wait 6 months. Now you put the crown, you've gone 1.5 years without a tooth. I mean, the protocols have changed, so now we're getting very close to where we can put an implant in and at least get a temporary crown or something on that day. I mean, we have cases now where a patient can have, say if they have only a few lower teeth left, we can take those teeth out, we can place implants that day, and within, say, 10 days, we got a lower denture that snaps on. It used to be, it was months before, 9 months before you would get that done.
Dr. Davenport, great information. We're completely out of time. Anything else you'd like to add?
Well, I think if there's only one thing that you would get out of this show is if there's anybody out there who is missing one tooth, missing multiple teeth, or missing all their teeth, I think they owe it to themselves to go get checked out to see what dental implants can do for their life and improve their quality of life. I invite them, you know, we have extra information on our website. You can check that out. It has information about dental implants, also references the great oral surgeon that I use. But basically, you know, I think that if they would check out dental implants, they'd be impressed and it would really help them.
Okay, well, thank you for coming on the show. Very interesting.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like more information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy